welcome to part 2. So you want to cut off a limb. Part 1 was more for family or friends to watch, or to help you with some ideas maybe of talking points or things to maybe just help that discussion along if your friends and family are calling you crazy or like think you're nuts because you want to cut off a limb, which we know you're not. So this section is actually where I start talking to you, the person who wants to cut it off, or still family members, or if you're the person having to make the decision. Anyway, welcome to part 2. Today, I'm actually a little bit planned out. We've covered talking to the family, so the next step would be, usually that's your first step, talking to friends or family, and the next one would be talking to your surgeon, which can be a pretty confronting thing the first time you bring it up. It was for me. This is like your big moment, right? So for me, when I brought it up, my surgeon was not very stoked with the fact that I had even mentioned the A word, right? So for myself, and I know a lot of people that have spoken to me about wanting to amputate, they're at the point where the surgeon isn't saying, let's amputate. Most people who've spoken to me, like when it comes to the elective thing, they're going, I'm done. Like I spoke about in the first video, I'm done with the surgeries, or they've had fusions that haven't worked, or if, like me, they don't want to do a fusion because they don't see it as the best choice for a ton of reasons, and I will do another video on that just to be like super specific as to why I chose amputation over. But most people talking to me about elective are going, I'm ready, I'm over the surgeries, I'm done, and I want to amputate, but the surgeon's not the one like bringing it up, or they've brought it up and the surgeon wasn't super receptive. This is exactly how my surgeon reacted. In fact, the first time I brought it up, it was probably a year post-op from both my legs. I crushed both ankles. It was about a year post-op. It was very evident that my left ankle was, like healing up, and my right ankle was not. I knew pretty much a few weeks after surgery that I had no joint space and it was bone on bone. Anyway, I brought it up. It's the first time I've ever seen him. My surgeon is quite relaxed, very easy to speak to, which I know is not like a ton of surgeons, but it's the first time that I saw him, like, instead of chilling, leaning back in his chair, like sit upright, and he got very flustered. Like, why would you bring that up? Like, why would you even talk about that? Like, blah. He was just, Although, even though he's very like chill and relaxed for a surgeon, they still like to be in control. So it threw him, he wasn't prepared for the conversation. And I think that a lot of surgeons probably have a similar reaction. From the people I've spoken to, anyway, surgeons have that reaction. So that is difficult, right? And then a lot of people that I speak to, I know they're like, but my surgeon said like, no. So that's the end of it, because, they went to medical school and like, that's it. I appreciate that. I'm not trying to take away from that. However, you can disagree with somebody and do it respectfully. So my biggest tip, like number 1, is it's fine to disagree, but do it respectfully. And that's quite okay. You just have to know, like, don't get angry, try to keep the emotions like low, practice conversations with family or yourself if you need to, but like try and keep emotions low. And let them know, like, I absolutely respect what you're saying. However, this is my thought, and it's totally okay to have your thought, even though you're not a professional. That's totally okay. So my biggest one is like, just remember to keep respect in the conversation at all times and try to keep emotions low if you can. So respect's the big one, obviously, but you also need to go in knowing what you want to talk about, and you have to be researched. So if you just, and I 100%, my surgeon didn't see eye to eye. He wanted me to fuse. We had a lot of conversations about the pros and cons of fusion, which, like I said, I'll do a video on, but we did not see eye to eye. You need to go in knowing what you want to speak about. So their time is precious, right? A lot of them are double and triple booked to try and see as many people as they can. They try to give people time. So also, you can't go in and say, like, I disagree with you, respectfully, but then have like nothing else to say. So you need to be researched. We live in an era, like at a time where you literally have the world of knowledge in your hands, at your fingertips, the world of knowledge. So if you go in and you haven't done any research, they're probably not going to be very, receptive to what you're saying, which is fair enough, because people do go in and go like, no, it's just gonna like, it's all emotional, and there's literally no research. There is no excuse not to be researched. I spent so long reading journal articles, reading studies, reading things that honestly were very difficult for me to read. Like I would read journal articles and like snippets from all sorts of things, and it took me like medical journals and all sorts of stuff, and it took me a long time. I actually had to sort of like go back and read and be like, what does this word mean? This is your limb. If you want to do this, do it researched. Like this I came across today is literally what I went in on my last conversation with my surgeon before we decided to operate. This is literally, I sent this to him beforehand, poor guy. He was happy to read it all. This lists my concerns with fusions. Like this is like what I've researched, what my concerns are. He literally called this War and Peace because it's so long. So I literally talked down like midfoot breakdown and triple arthrodesis. This is what I've researched. These are my concerns for myself. Function, fit for purpose, and quality for life. This is like my opinion and my research on it. These are my concerns. Fusions, baloney amputations, my concerns. Like, my God, concerns continued. Microprocessor ankles versus other prosthetic amputation questions. More amputation questions. Post-surgery logistics and discharge process. Major concerns. Physically, psychologically, accessing hospitals from the heart. Like, it just goes on. Like, okay, like I'm a nerd about it, but this is literally your life. And we have all this information here, and I think this, and I think that surgeons think this too. Like if you're coming in and you've just done no research and it's literally all here, then you're not disagreeing respectfully with them. And I have spoken to a few people who tell me that they want to get amputations, but have done no research. So I ask a few questions that I would assume people would have researched. Nothing. And they just tell me that they go into the surgeon and they're just like, I just want you to cut it off. And that's all they have to say about an amputation. The surgeon says no, so then they go and get a 12th surgery and another surgery or fusion that they say they didn't want. They wanted to amputate, but like didn't happen, couldn't be bothered to research it, or it was too overwhelming, like whatever. It's never going to happen if you go in and just say cut it off and have no research. And like, if you don't want a fusion, you don't get a fusion. I didn't want a fusion, don't get one. If you don't want a 15th surgery and you want an amputation instead, that's what you do. Like you don't then go ahead and do the 15th surgery. Find another surgeon. My surgeon did not listen to me in my, like, I was calm, had all my questions. If my surgeon didn't listen to me, I would have found another one that did. Simple as that. However, if somebody came in to me and just said, cut it off, and they'd done no research, then I wouldn't listen either. So do your research. Number 2, do your damn research. Talk to as many people as you can. Reach out on social media, talk to people, like do your research. Go to rehab clinics. Talk to your surgeon or talk to your GP or whatever, and find a way to, like, that's what I did. I went and visited an amputation clinic, and I spoke with a registrar and like 2 specialists while I was there. It was great, it's wonderful. Also talk to functional therapists, yay! They have very different opinions to surgeons. Talk to as many as you can. I spoke to literally multiple podiatrists, physios, OTs, tons of each one of those, like multiple of each I went and visited and spoke to get their opinions. My surgeon sent me to another surgeon for his opinion, and he sent me to his physio for an opinion. It was actually hilarious because he sent me to he was like, you need to see my physio. So I went to his physio, and I think he was thinking that his physio was going to be like, no, you're crazy, like don't amputate, you need to fuse your ankle. And so I walked in, like, what's up, like I'm here because Ben sent me, like blah blah blah. Anyway, I told him about the activities that I wanted to get back to doing because I was, half my weight almost and really fit. And anyway, I told him all this stuff I wanted to do. I also wanted to do Machu Picchu, which I was really wanted to do with my brother, and then I have an accident, he ended up going. Anyway, my surgeon's physio literally laughed when I said I want to hike Machu Picchu. He laughed and said, if you fuse your ankle, the only way you're going to walk Machu Picchu is backwards. So my surgeon sent me there thinking that he would agree with him, and he totally disagreed with him and agreed with me, which was actually, like, that felt really good. But every functional therapist that I did see pretty much agreed with me. I'll be honest, nobody said, yeah, cut your foot off. Nobody is going to do that. No functional therapist is going to, and see a prosthetist. Like, go and see somebody who makes prosthetic legs and talk to them, book in for an appointment. I did that and it was amazing. And he actually gave me a ton of points to talk to my surgeon about, which I'm about to tell you. But no functional therapist will tell you, yes, cut it off, or you'd be hard pressed to find one. However, they did agree with me without agreeing with me. So all of my concerns that I had about whatever that last option is your surgeon is giving you, for me, a fusion, they all agree. They didn't say cut it off, but they did say, yes, like you're concerned about your midfoot breaking down and needing like a triple fusion. Yes, that's going to happen in a matter of years if you're as active as you want to be. Yes, you're not going to walk up hills. Yes, you're not going to hike. Yes, you're not going to walk on the beach. Yes, you're not going to do all of this stuff. So nobody said do that, but they still, agreed with my concerns. So I could go into my surgeon and talk to him about these concerns going, I've seen other specialists. I've seen anyway, do your research, talk to other specialists, get their opinions. Because as a surgeon myself, if you walked in with absolutely no research, I would not find that very respectful, and you're just going just cut it off. I'm like, okay, well, but why? Why do you think they want to know that you know why their option isn't going to work, or why you think their option isn't going to work, So I'm saying, no, I do not want to fuse for these reasons. But if you just go, no, I don't want to do what you're suggesting, but I have no reasons why, I'm trying to cut it off, probably not going to listen, right? And I get that too, because it frustrates even me when people talk to me, and spend all this time, and I'm happy to give the time to talk to people, and then they're like, I just talked to my surgeon, I just said cut it off, and I'm like, well, did you not listen to what I said? Do you really want to cut it off in that case? Because if you can't be bothered to do any research, your surgeon's probably going to think you can't even bother to research it. Do you really want to cut it off? Anyway, that's just my view on that. I would totally think that way, and I think a lot of them do, which is why I feel like people hit those roadblocks. Anyway, it's just my opinions based on what I've been through. Anyway, so let's say you've done all that, you've spoken to it, your surgeon's starting to be a bit more receptive, right? This is going to happen over a matter of visits usually. The next one is actually talking about your stump, your actual chop day, right? So there are important things to ask. If my surgeon did not answer these the way that I wanted him to answer them, I would have gotten up, I would have left the room, and I would have found another surgeon. I would have wasted the $180 that you spend for that visit. I would have spent $300 for another first visit with another surgeon, and I would have started the process again with another surgeon if he had not answered these questions, and I'm about to tell you to ask correctly, and I urge you to do the same. These are questions that I found to ask while doing my research. This is why research is important. I got this from my prosthetist, I got this from physios, and I got this from the internet, from researching journal articles. So, first question, stump length. At what length do you cut my stump? Or where do you cut? Question. The answer should be 20 to 25 centimeters from the bottom of the kneecap. Awkward position. So kneecap ends here, 20 to 25 centimeters below the bottom of the patella is where they should be cutting. That is optimal stump length. People ask me why I didn't just cut off my foot. Why did I go for the full below knee amputation? That is what your surgeon should be wanting to do, a full below knee, not just your foot. Now, obviously, sometimes they have to cut stumps shorter. That's usually in trauma, or if you have, cancer in the bone and they need to cut higher. But if you are going in for your ankle and the rest of your leg is healthy, then it's 20 to 25 centimeters. If the stump my stump probably ends here, right? If your stump is too short, if it's here and the rest is like a pole, you lose it's much harder to walk in a prosthetic. You lose balance, you lose control. The more stump you have, the better. However, too long is also a problem. If my stump, so this is where it actually ends. This is componentry on the inside. So the button to let it go and stuff. So if my stump, and I just cut off my foot and my stump ended here, the bottom of my leg, there wouldn't be room to then put this foot on the bottom. Probably a better leg to show you with. So if imagine this, but they cut it too short and it's here and this pole is this whole length, you lose so much control. And now a lot of people have short stumps because they have to. But if you don't have to, don't get a short stump. There's fit issues. It's much harder to fit a prosthetic. It's harder to get the liner to like fit well and to sit in, and you lose tons of control. I have so much more control with a long stump. But again, if my stump was cut here, we wouldn't have room for all this componentry. When you have a bit of room, you get to put in some really cool stuff on your legs to make your prosthetics work better. So too long is a problem, and you won't get as much out of a prosthetic as you could. Too short is a problem. If you're going in, and people go in and have elective surgeries and their surgeons cut their stump bullshit short, and it makes prosthetic life much harder. They need to be cutting at the right length. My surgeon did not answer that question correctly. That would have been it. I would have gotten up. Thank you. See you later. I would not have operated with him. Done. Okay, moving on to the next one. It's really important. And even my prosthetist has said, I've had people with elective surgeries who come in and their stumps are cut so short. And I'm like, why? Just ask the question, make sure it's the right answer. If it's not the right answer, ask why. And if you don't think the answer sits right, walk out. Or tell them, this is why I don't think that's correct. Or you can ask them, cut it at 25 centimeters if you really want to operate with that surgeon. So stump length would be my number one. Reinnervation would be my next one. Nerve pain is obviously the really big risk. Obviously infection is as well, but nerve pain is the big risk, and that is the big thing that a surgeon is going to tell you, like, if you have nerve pain, you're going to wish that you never amputated. I was told a ton. I went to one of the hospitals here. My surgeon actually happily sent me along with a referral to chat to the team at a rehab clinic. And the first thing that the registrar told me was, don't go into surgery thinking you're going to get nerve pain, because not every amputee does. Very different to what my surgeon was leaning towards, right? And you don't. Not every amputee does. We all get a little bit here, and after surgery, of course you will, because your nerves have literally just been cut. That's like surgery nerve pain, right? But nerve pain in the sense of like debilitating nerve pain, not every amputee gets that. You will at points in your life, yes. I would say I don't have nerve pain, but I do. I get days here and there where it flares up a little bit, or at night it's like, it's a bit painful. But I do not get like debilitating, extremely bad nerve pain. Every now and then it's like, it's there. But I'm talking like a day in a month or 2 days in a month. Other than that, I get sensations like of my foot, but that's it. Compared to the chronic pain I had, a few days of nerve pain, that's very little, is quite fine by me. So reinnervation, which was the whole point, circling back around. This is, now amputees, years on from their amputations, go and get this done. Why not do it in the first place? There's a few reasons. One, surgeon doesn't do it. Not all surgeons do it as a standard best operating practice. So ask and make sure they do. What it is it's, so say you go, if you get it done at the time, much better. So as they cut, also ask them how long they cut the nerves. So they're cutting your stump at 20 to 25 centimeters. The nerves should be cut longer. Ask them that. Make sure you know that they're cutting the nerves longer. When they cut the nerves, so you cut here, but the nerve is here, so they actually like keep the nerve longer so that they can move it around and like rehome it into muscle. That's reinnervation, the rehoming. So sometimes they don't rehome the nerve like into a muscle, they're just like straight cut. That can happen, let's say, if you're at a public hospital having the surgery done and another trauma comes in, car accident that's more important, brain surgery, spine surgery, whatever. People get bumped out of surgery, right? It's like, you need to wrap this up. So they finish the amputation more quickly. Nerves are left cut, and not rehomed properly. That causes a ton of nerve pain. The reinnervation is about like actually rehoming it into muscle, and it helps the body sort of like think it's recreating like a circuit, and it's not left raw. It's not left right near the top of the skin. When it's left near the top of the skin like that, and you put on a prosthetic and it pushes on it, it's gonna hurt, and you're gonna have a ton of trouble getting into a prosthetic. When it's rehomed into muscle, I have one where I can feel, I know where it's been rehomed, and so, but you can push on it, like the prosthetic can push on it, and it doesn't hurt. Reinnervation. Obviously, there's more to it than that, but that is my like dumb brain's way of sort of like explaining it. So you want to know the length of your stump. You want to know how long they're cutting the nerves. You want to know that they're cutting them longer so that they can rehome them. If they cut them short as well, nerves are pulled tight. when they're tight, after a surgery like that, it hurts. That causes a ton of nerve pain. So ensuring that your surgeon cuts it longer means that it's relaxed, it's not pulling on the nerves. When people have traumatic amputations, like a leg's blown off, and they're trying to salvage as much as they can, so let's say to make you a below knee instead of an above knee, that's when usually there's short nerves. So there's not a lot to work with, and a common problem then that causes nerve pain is that they are short and that they're like stretched and pulled. So make sure stump length of the nerves, and do you rehome them? I actually didn't even ask him that. I said ask him to talk me through it and make sure he talked about those points. The time that it takes to do the surgery is another big question. How long does it take you? If they say under an hour, personally, I would have left as well if he had have said anything under an hour. My prosthetist actually told me to ask a lot of these questions, and he said to me, like, don't even, because amputation's done. He's like, there's just not enough time. If they're done under an hour, there is not enough time for them to treat the nerves well and to spend time rehoming them and to close you up well and all of that stuff which affects nerve pain, right? So if it was under an hour, I just would not have operated with him. That's also why personally I chose to go private, because I knew there was no risk of something more important coming in, and that unfortunately can happen. If that did happen, if I was public, I would have been asking my surgeon, how long did it take? Did you have enough time? So I was aware of any risks. That way you just know, like maybe you're up for a stump revision later on and you're aware that, maybe they didn't have time to handle the nerves the way that you would have liked. They're the questions that I would be asking. So not everyone gets nerve pain, and asking those questions helps mitigate the risk a lot. I would also be asking my anaesthetist how they, sometimes you only see your anaesthetist right before surgery. You can still ask, still have that educated, calm, respectful conversation with them. So I know my anaesthetist because I operate with my surgeon and my anaesthetist. I've had many, and I do not operate with this surgeon unless I have a day when I'm operating with this anaesthetist. In my mind, they are just as important because they're the ones keeping you alive. So that's my decision to choose both. So we have a good relationship, but again, respectful. You'll have a good relationship. Ask them what their plan is for numbing. So not just putting you to sleep, but actually like numbing the leg beforehand. When I went to the rehab clinic, one of the registrars who told me, not everyone gets nerve pain, so don't go into surgery thinking that you will, also told me that the way as an elective, as nerves remember what they're feeling, is what she told me. And so she said, and then I researched this as well, and the research also says this, they kind of like, so say if you have traumatic and a leg's been blown off, it is like more likely to have nerve pain for a lot of reasons, like I spoke about, not having time, not being able to like rehome nerves well, but nerves kind of remember that last trauma that they felt. So I was in chronic pain before, and she told me in the month leading up to your amputation, manage your pain as best you can, like better than you have. So if you're not on medication now and painkillers, because you need to function and work, she was like, get on them before your surgery so that you go in and your nerves are not like remembering that chronic pain right beforehand, which I thought seemed weird, but research says. On the same note, for you to talk to your anaesthetist about, again, I dug deep dive into this because I'm a nerd apparently. And so if they numb your leg, so I didn't have an epidural because that's like waist down, waist like high, wherever they put it in your spine down, like whole body. But what they can do is put in nerve blocks. And one, it helps with your first few days after surgery because you'll stay numb for a few days. So in the first few days that the stump is painful, like you don't feel it, which is great. But if they numb it before they cut it, the nerves are like not feeling that trauma as you're amputated, and that apparently has a huge difference on nerve pain. I don't give a shit if that's a placebo, like whatever. I have read about that, and I asked my anaesthetist that before surgery, and I said I would like to, and he said, yep, not a problem, done. We will put a nerve block in like the two main nerves in your leg, done. Small conversation to have that may have made a huge difference. As I said, I don't have nerve pain. I do get nerve pain. That's a lie to say no, but like really I consider saying like I don't have nerve pain because like it's just not debilitating. It doesn't really affect my life. Every now and then I have a day when it's painful, but really I don't get nerve pain. I also did a mirror therapy post-op. Do your research on that. It is incredible. That is what I'm gonna like leave you with. I will talk a little bit more about mirror therapy in my next video, which will talk to you about post-op. So the next video will be what to expect post-op, like first few days after surgery, tips to like set up your home, and some advice that I wish that I had post-op. There's definitely a few things, but I will talk about mirror therapy there, but like do your research on mirror therapy because it is actually freaking credible. And the guys who talk about mirror therapy who've had amputations have had very traumatic amputations and say it's better than drugs they've been on. So like super cool. So that's, I guess this was just like my like tips for talking to your surgeon and yeah, going into surgery. My next one will be about afterwards, but they're my top tips. You know, you don't have to ask all those questions to your surgeon if you don't want to, fine. But like you have the ability to, if this is an elective amputation, you have the ability to come out with a perfect length stump and fit in a prosthetic very well. You have the ability to ask the questions and make sure your nerves are handled well in the first place, so you don't have to go and have a revision surgery later on and then be out of your stump for 3 months or out of your prosthetic for 3 or 4 months while it heals. Like, you have the choice to do that now. I suggest doing it now, but that's just me. I wanted to make sure I had a stump that was a good length and I could fit in prosthetics well and get the most out of a prosthetic. I suggest asking those questions. 100% forgot another question to ask. How do they close you up? This is a personal thing. A stump, I'm gonna show you a stump, okay? Like if you don't wanna see an uncovered stump, don't look now. So it is a big incision, right? These are like muscles. It's like your whole leg's getting like choked back together. This is not just an incision for like, we're just like putting some pins in your leg and we just like stitch back. This is a big, heavy, chunky incision, okay? So do they use stitches or do they use staples? If I had a surgeon that I knew used staples on anything, and I mean any of my ankle surgeries, my hand surgeries, anything, I would not have operated with them because quite frankly, it's fucking lazy. There are times when you need to use staples, yes, for quick access. Chest, for example, if they need quick access into a chest. Nurse, so this opinion, like obviously I've also gotten from my mum, like chest, you know, if something goes wrong after surgery, the staples like bang, take them out, open you back up, do something like emergency, like gut stuff as well. So there are times when staples are needed. There are times when you should be using stitches. Like if I needed and I had an ORIF in my hand or like my arm or whatever, and I knew you use staples, like it's lazy. So to relate that to your amputation, you don't want somebody who wants to do something quickly. Like this is what staples tells me, right? It's not just like, oh, you're lazy, but it means like, you want someone who wants to take the time. They're literally rehoming your nerves. They're cutting every piece of you, and how your nerves are handled affects it. I want somebody who takes extra time and has very good attention to detail. Using staples tells me they do not want to take extra time and they do not have good attention to detail. Like that is what staples tells me. And like I said, my mum, that was an opinion I got from her as well. So yeah, if he told me he closed with staples, I wouldn't have operated with him. I know this sounds you have the choice, right? Like I know that people are going, some people just listen to this and be like, oh, what a wanker. And that's fine, you can think I'm a wanker, but I don't have nerve pain. Like, you know, I have a perfect length stump. I literally started like back squatting to a box the day I took my prosthetic home. The way your surgeon operates matters. Who you pick matters. I wanted somebody who was going to take the time and do the stitches. I knew he would too because I've used him before for my ankle surgeries. He never used staples, and he has cut through I'll show you a tattoo multiple times, and he is so proud. He's like, got your tattoo back together, like it looks nice. You can see like how proud he is of his work, that he has done that. He would never have left that tattoo looking shitty because he just wouldn't have done it. It's not his work, you know, like he's proud of his work. Excuse my horrible tan, but just never sticks well here. So he has literally like cut through this now 3 or 4 times, and it is so, obviously they can't help that, but like it's so well in line. Again, the tan just does not stick anywhere near incisions, but you can see he has cut through this again, multiple times. What's really funny is it's this like first tattoo I got that I literally don't care about. Like, I was like, I don't even give a shit if it looked like if it looked terrible, but he was so proud of his work and his attention to detail, and that is what's important. You know, at the end of the day, sure, I might sound like a wanker for all of these things that I'm saying to check with, but I don't have nerve pain. I back squatted to a box day one I picked up my prosthetic. I have literally been, they tell you, you know, just wear it for a few hours, like, you know, blah, blah, blah. I've been in my prosthetic literally 10 hours a day minimum since the day I took it home. Like, put it on and off I went, and I've not needed revision surgeries or anything. So, but yeah, that's all the questions I would be asking, and personally, I think all of that adds to why I have not needed a revision surgery, why I don't have nerve pain, and just why I've had overall such a great outcome in a prosthetic. So, you know, you have the choice. If it's elective, you have the time and the choice to, you know, ask these questions, make sure things are done the way that you think they should be done, and just get the absolute best outcome. Like, if you're making this choice for a better outcome, make it even better again. Like, you have the ability to. So, yeah, that's it. So, I know that a lot of people don't think about this stuff, so I do sound like a wanker when I talk about, you know, staples versus stitches and that sort of stuff. But anyway, I've had such a good outcome that I'm going to say, you know, like, it's obviously helped. Anyway, next video is going to be about post-op, what to expect, things I wish that I knew. So it's going to be part 3, so I'll see you for that.